I hope this demonstrates to you President Trump's very deep commitment to Uganda. Most importantly, thank you for the long-standing and very deep partnership that the United States and Uganda have had in the field of public health. As the Ambassador and His Excellency mentioned, the United States contributes over $500 million per year to healthcare here in Uganda. That is one of the, if not the largest healthcare commitments the United States makes with any other nation. And there's a reason for that, because it is money well spent. Uganda performs. It delivers. It has one of the finest laboratories. It has one of the finest viral research institutes in the world. It serves as a reference laboratory, not just for Uganda, but for the region. Highly respected. It is Uganda that discovers so many of the emerging infectious diseases. But so much of the investment, as His Excellency mentioned, has been in the field of HIV/AIDS through the PEPFAR program, as well as the President's Malaria Initiative and the maternal programs to protect maternal health and protect mother-child transmission of HIV/AIDS. Those programs, though, what we've been able to see on this visit is how important those programs have been in supporting the building of the broad public health infrastructure here in Uganda. It's those investments and those enhanced capabilities that help Uganda so effectively deal with the Ebola crisis. And I have a very great partner in Uganda, the Honorable Minister Acheng, who is coming to the stage. We have a very close relationship. We speak regularly on the phone and meet regularly. And she and the Ministry of Health have put in place very effective and comprehensive border screening, public health evaluation, isolation facilities, Ebola treatment centers, and really a model for the region in terms of Ebola preparedness and response capabilities. So the people of Uganda should be very, very proud of their minister and their Ministry of Health and their actions. And we will be meeting next week with fellow ministers of the Great Lakes region at the UN General Assembly meeting to share best practices and coordinate the regional response to the Ebola outbreak in the Eastern Democratic Republic of the Congo. It is important to note that Uganda does not have Ebola, in part thanks to the excellent surveillance efforts of the ministry. So, Your Excellency, thank you very much for the deep partnership that the United States and Uganda have in the field of public health. I have with me, representing that, the Director of the Centers for Disease Control and Prevention, Dr. Robert Redfield. I have the Director of the National Institute of Allergy and Infectious Disease, Tony Fauci. I also have with me Admiral Tim Ziemer, one of the senior leaders of USAID, also representative of the National Security Council in the White House, to the work of many in the Ebola outbreak in 2014 to 16 in West Africa, including the leadership of the ambassador herself when she was the ambassador to Liberia. We have tools that we did not have then. We have an experimental vaccine that has already been dispensed and used in over 220,000 individuals that is proving both safe and effective in that use. And an application has now been accepted by the Food and Drug Administration in my department for the priority review approval of that vaccine. The United States has worked to continue to procure additional supplies from that manufacturer to ensure adequate world supplies. And we work with the World Health Organization, Gavi, as well as the relevant ministries to ensure that the countries have what they need. In addition, thanks to work of African researchers as well as the National Institutes of Health, we have 2 therapeutic products that now can potentially treat individuals who have Ebola. A clinical trial was run in the Eastern DRC, is still underway actually, that proved so successful for 2 of 4 products that the trial was amended to continue only with the 2 products, and those products will now be subject to processes at the FDA for review. And we're working with the Ugandan Ministry of Health to ensure that those products would be available in the event of there being an Ebola patient here in Uganda. When I was at the Ebola treatment center in Butembo in the Eastern DRC, I was able to see the fruits of this work, to see individuals who had Ebola to be cured. So now, instead of going into an Ebola treatment center sick and dying, now if you go in soon enough, immediately having symptoms, and receive this treatment, you may walk out cured.
To Uganda, from Congo, and from Rwanda, and he has come to see for himself and on behalf of the American government the situation of Ebola in this part of the world, especially in Congo. The Ebola recent epidemic has been lingering there for some months now. A few cases in Uganda have been reported, mainly emanating from Congo. However, we always stamp them out quickly because somehow we have some experience and some organization. We are grateful to the American government in their role of combating these infectious diseases. They have a strong organization called CDC, Center for Disease Control, which we came to know when we were dealing with AIDS initially, and we knew them even more when we had a few cases of Ebola. That's when I started interacting with them closely. When we had the first cases of Ebola in Uganda, we did not have a capacity here to quickly diagnose the sickness. We had to take the samples to Atlanta in the United States, if you have heard of the geography of the US. Atlanta is the city where President Jimmy Carter comes from, if you have never heard of course, as some of the other sicknesses. Why? This is because it manifests quickly. I think they told me that from exposure to the gestation period is like 7 days. How many days?
On average, 7 to 14 days, as long as 21 days, Excellency.
Okay, so within 21 days, if somebody has had contact, it will come out. Now, this makes my work easy, the work of the warriors against Ebola. Because if somebody has been exposed and you follow up, you identify them, you identify the ones who got in contact with the person who was sick or who died, then you observe them or isolate them, and after 21 days, they will either have developed the sickness or they will be safe. So because of its aggressiveness, actually it is easy to deal with. If it was a more silent, that's where diseases like cancer are very dangerous, because they can come quietly you don't notice it until it is too late. But this one is aggressive, shows quickly, and therefore for me I'm not so much worried. It spreads where there is no proper control or proper attention. It is not actually a medical problem. It is mainly either political or organizational. It's more of an organizational problem than a purely medical problem. But because medically, really it is easy to deal with because of its characteristics of quick infection. And even when it was killing, people, when there was no way of stopping it, killing is part of termination. Because if you kill quickly, then that one is dead, is no longer in circulation. It's bad, but in terms of control, it is easier than the one which lingers on and on without, especially without being surreptitiously, quietly. So because of that, I'm not really, we shall always control it. It is easy. But now with these additional interventions, where there is even a vaccine, now there's also some therapeutic treatment. So it seems now we are going towards the issue of bringing the patient quickly to treatment in case of exposure. And even here in Uganda, those 200,000 cases which the Secretary talked about, the ones who have been immunized, who have been vaccinated, some of them are here in Uganda. They decided to do it in a good way. They decided to deal with the frontline warriors. Who are the frontline warriors? The medical workers, some of the immigration officers who are near the border. Those are the ones who are immunized. They are part of the 200,000. So, with immunization, with the therapeutic treatment, with the characteristic, because it seems Ebola is not a long-distance runner. It is a sprinter. It sprints within 100 yards, 100 meters. It's not the other one, marathon, where you go on for a long time. I think it is actually easy to control Ebola. I'm not very worried about it. Even the case, if there is any case which went to Tanzania, which people are talking about, I'm sure we shall. Here locally, we have already started following up that person, the contacts she had here, where she was staying in the hostel. Now, the only other little complication I had today was that somebody may fight Ebola, defeat it, but then some of the virus retreat to some of the body organs, body glands, and hide there. And that, but it seems when you test, you can still find out, even if those viruses are hibernating in the body. It seems you can find out. That's what I was able to. You can find out, and then you can be treated. So I don't know whether my quasi-medical explanation. Would you want to add a change?